I think the most important thing is to loop the patient in. Sometimes we wanted to ensure what is their concern. Their concern could be multifactorial. The main thing is to avoid panic, both from the patient's end and from the office's end. So to avoid panic and optimize safety while still maintaining efficacy. I really think that communication is important. I know it sounds a little cliche, but this is the time more than ever that communication between the provider and the patient is important. It's a two-way education between the healthcare provider and the patient, and we have to mutually agree upon the decision. So you'd be surprised some of the questions I get from my patients on, hey, I want to stop this medication because of X, Y, and Z. And these can range from fear of medication, high medication costs in light of the poor economy, concerns about getting access to the medication, like insurance coverage, even whether they're getting the shipment still in light of COVID, and recently a lot of job loss leading to loss of insurance coverage, and also the risk of catching COVID on their medication. But I've had questions from patients where they say, should I stop my acne medication? Will that be putting me at higher risk of getting COVID? So clearly patients are hungry for information and they're just doing whatever they can to ensure their own safety. So just like what I said earlier, we have to assess the theoretical risk, discuss alternative options, and design an action plan. That's very, very important because if we were to continue or stop the medication, a regular telehealth check-in is so important, whether to determine whether there is a need for adjusting or blood draws, and give the patient very clear instructions to define their threshold on when to call and when to discontinue the medication. For example, if the family member were to be infected by COVID, that is an important discussion to have with the patient on whether to evaluate the risk and benefit of staying on certain medications. And it's also very important, lastly, to reassure the patient that they have access to you and your office staff when needed. This will limit panic and concern and limit the unnecessary urgent care or ED visits exposures that may have.